before we start, we'd like to honor our judges with a small memento and a certificate. I'd call Dr. Annie and Shobhana ma'am to please come over and felicitate Dr. Uma Narayanamurthy ma'am. Oh, that's okay. And now I call Dr. Baishali ma'am. Yeah, I'll tell you the rules is 8 minutes for the presentation and 2 minutes for question answers. At 6 minutes, we will show you this. Presenters, are you listening? At 6 minutes, I'm showing you this 2-minute timing. And at the end of 8 minutes, I will ring this bell. Right? So are you ready? Sir?
We are very happy to one and all present here. Myself, Dr. A. Venkatesan, Associate Professor, Department of Electrical and Electronics Engineering, National Institute of Technology, Puducherry, Karaikal. And my topic of today's presentation is music as open elective course for holistic wellness of the institute. So that is my topic of today's presentation. So from the morning onwards, we were talking about all about salutogenesis for wellness and for stress management and all those things we were talking in the morning. And in continuation with that, I would like to give some introduction before going into my study. So we all know that in this today's modern competitive world, all the students, not only students, we are also in peer pressure. So we are facing stress and anxiety. So all those things students are facing. And salutogenesis recently it assumes importance for wellness, and it focuses overall psychological well-being and mental wellness of the individual. So that is what recently we found out. And music, we all know that it is divine gift to people, and the whole world is filled with music. The whole world is vibrating. So morning, Bhuvaneshwari madam told that Nadam. So Nadam, nothing but it's a sound, and integrating music into salutogenesis. So that really helps to overcome stress, and it makes the students to focus more on their academics, and they help the students to reduce their anxiety, etc. It has many beneficial effects. And so some of the literature review, I have gone through this. So many papers I have seen, and some of the papers I have listed out here. And finally, I have arrived at this conclusion. The green color, what I have written, that is what my conclusion from the literature survey. See, actually, music therapy centers are available separately, and students are getting music therapy sessions separately. But music course, it has not been introduced as the course in engineering domain. So that is the novelty in this paper. That is what our main focus here. So this green color, that is what I identified. The music therapy centers are available, but not as course for professional students. Even here, we are having music therapy center. We are giving therapy for many students and patients, but not as the course for professional students. And second thing is that, of course, IIT Madras, so that is one of the engineering institute in Chennai, they have introduced music as online open elective course. They have introduced this course in Svaram portal for engineering students, and this is not offline, this is online. And the course has been taught by the Carnatic vocalist with external resources. Actually, they are utilizing Carnatic vocalist externally, not the faculty within the institute they are training the students. So that is what the gap I identified. So with this gap, being a trained Carnatic vocalist myself, so I have learned Carnatic music for the past 8 years. I have completed certificate course on Carnatic music. And out of my own passion, I have introduced Carnatic music vocal course as offline course. So both theory and practical sessions I have offered for the students. So that is the novelty in this paper. So Carnatic music vocal course, offline mode, both theory and practical, is introduced as open elective course for UG engineering students in NIT Puducherry, Karaikal. Actually, this course is introduced with the motive behind National Education Policy 2020. So what National Education Policy 2020 is saying is that we should have holistic education. We should not focus students only with respect to engineering aspects. We should not focus students only with respect to medicine aspects, law, whatever may be the case. So we have to give holistic education. So to make the system holistic, to make the students to get away from their routine academic life, so I have introduced this music as an open elective course. So I myself framed the syllabus for both practical session and for theory session, and I have been teaching the students in our institute. So here, what is the major difference between the existing system? What we have introduced is that existing system, it is online mode, and some faculty from outside, they are coming and teaching. But the present system, what we are offering is that it is not offline, it is not online, it is offline. We are having the direct eye-to-eye contact. So morning also, madam was talking about the interaction, the eye-to-eye contact, all those things. So we are having direct eye-to-eye contact, and we are teaching the students like a Gurukulam style. So we used to make the students to sit on the mat, and practical session we are teaching like that. And theory also, theory normally we will teaching like this mode, and practical session we are teaching in a Gurukulam style. So that is what the major novelty. And of course, we are not utilizing any person outside. We are not utilizing any resource outside. Whatever the resource available in the institute, that as me. So myself is teaching the students. So without spending any money extra, so we are making the available resource, what is available in the institute, and we are teaching the student. This is what the first question has been asked by our board members. When I introduced this course in our Senate board, that is the first question they were asking. Whether any person from outside, they will come and they teach. Because they have to spend money for that. I said, no, myself will handle this course. So that is the novelty in this method. And this is the new and major contribution of the paper, and the response of the students are studied qualitatively. And this is what the methodology we have followed. And actually, we are giving this course for the students ranging from 19 to 21 years. And 11 students, they have registered the course in even semester, and 7 students in odd semester. And one practical session is about 50 minutes. And totally, we are handling 100 minutes per week for the students. And we are teaching basic lessons, Carnatic bhajans to the students. Students also, they sing along with us, and they get mentally free and relaxed. And this is the class that what we have been teaching to the students. So I am sitting in the middle, and all the students, they are learning the music. And this is one paper cutout. So whatever we are doing, that has been published in the news Hindu, the Trichy edition. So that has come out. And this is what the response we received from odd semester students. So this is what we received. This has been a total new experience for me, sir. And I am very grateful that you have given us the opportunity to experience this subject. You have been a wonderful guru, and it's a big encouragement for all of us. Thank you, sir. Learning this course awakened me, made me feel good inside out. I enjoyed learning Carnatic music. Thank you so much for showing the world of Carnatic music, sir. It actually feels like a sunshine in my otherwise dull life. So whatever the line which I have indicated in green color, this is what we need. So definitely no, from the feedback, we understood that it is giving different dimension to the students. They are mentally free. They are very much relaxed. And this is what the second response, too good, had a good experience by learning music. So that is what the feedback we got. And I play one 2 minutes video. This is the video given by one of our students. It is there inside, ma'am. In the folder. Yeah. sound. So this is what the video he has shared to us. He is saying the course is very good and he is feeling very much relaxed, and it's a different course other than the normal course. That is what he is giving the response. I think the sound is not audible, so we can move forward. Later, I will share the video. You can listen what he is saying. Let me go to the, yes. Yeah. So the conclusion, that is what really it is giving different dimension to the students. The students are feeling very much relaxed. So this course has got very good feedback from the students. So this is what my future implication in our institute. Every engineering institute now is having medical health center. It is taking care of the students medicinally, right? So we are having medical health center. It is treating the students pharmacologically using medicine, everything. But we should embed this salutogenesis center using music therapy or yoga therapy along with this medical center for the overall holistic wellness of the institute. So that is what my conclusion and future implication. And these are all my references. So I am thanking you all by quoting this word as music is medicine for soul. So thank you one and all. I thank the whole team for giving me this opportunity to share my ideas in this conference. Thank you, ma'am.
Thank you, sir. Okay, we are calling Nilachal for his presentation now.
Thank you, ma'am. Is it audible? First of all, thank you all for this opportunity. So basically, the sound is everywhere, and sound and vibrations, it is all over the universe. If you see, the vibration is there. And in the ragas, Carnatic music, Hindustani, if you see, there are sub-swaras, and among them, like Sajjam, this is one of the first sa, where it is being recited in a way so that we a prayer for that reciting for the sa. So there are all other re, ga, ma, pa, dha, ni, sa. So for all those, there are different prayers are there. So I wanted to recite this, but with the time, I don't think it will be possible. But coming to the next thing, in the all universe, the vibration that we have, one of the most important vibration that we need to have is the pranava. So pranava is something that is all over the universe, and there are a lot of researches are going on the sound of Om, and in different languages, different religions, it has been the sound has the vibrations is being studied, research is were being going on. So irrespective of any biasness in terms of the religion and the barriers of any community, this sound has a lot of things to heal. And this sound has something that heals not physically, but mentally in a holistic way. So it is the sound which actually helps to heal in a physical, mental, and spiritual way. So we have a study, I did a study, a case study on the immediate effect of Om chanting with a couple integrating with the yogic practices. So what effects we can get with those practices? So starting with that, like Om, as I mentioned, it is that which has the eternal existence. It is the sound of the sounds. Actually, the music of the music. Basically, there are two kinds of sounds. If you see, when two objects strike, so a sound is produced. So, but there is another kind of sound which does not need any other object to get the sound. And that one sound is the pranava or the Om. So it has its own significance. And we try to chant it and we observe like how it happens. So there are already a lot of studies that has been done, and it was found in that the lot of autonomic changes were being observed. So we also tried with a couple of other things that were included in that, like the practices of yoga. The yoga therapy is not complete with the sound, and especially with the pranava. So sound is an integral part of the yoga practices. So what we did, we took the aim to investigate the immediate effect of pranava with a practice of Savitri pranayam, a practice of Savitri pranayam. Basically, we inhale the duration that we inhale, the half of the time of the inhalation duration is hold. Then again we exhale, and again the half of the duration of the exhalation we hold the breath. And again after that we did a vibhaga pranayam. In that we inhale like for example, we inhale for 6 counts, we hold for 18, then exhale for again 6 counts and again hold for 18. So this is a very advanced practices, but it helps in the complete from the lower, middle, and upper lungs stimulation. So this actually helps in giving some autonomic changes in the body. And we wanted to see how the chanting of the pranava or the om will impact the autonomic changes, autonomic system. So the methodology that we used, like first of all, we actually in the pre-study, before starting the practice, we did 5 minutes of the HRV, heart rate variability. And after that, we try to practice, immediately after that, we practice the Savitri pranayam of like 6 minutes, 6 to 7 minutes. Actually, it depends on the time duration. For the 6 minutes, we did the Savitri pranayam. After that, we practiced the Vibhaga pranayam for again 6 minutes. And after that, immediately we practiced chanted Om for 27 rounds. And after that, we try to observe what are the impact of different practices. So in the HRV, we have basically 2 kinds of domain or 2 kinds of frequency, 2 kinds of readings that we get. One is basically the time domain, where we take the RR variable, HR variable, and all other things. And in the frequency domain, we have the high frequency and the low frequency. These basically help us to determine the autonomic response, how our sympathetic nervous system and parasympathetic nervous system actually work. So we first did the baseline study, then Savitri pranayam, the Vibhaga pranayam, then the Om chanting for 27 rounds. Then we collected the data that we get. Then we recorded the ratio, LF, low frequency and high frequency ratio, and the observation were done. So she is Dr. Sangeeta Laura Byagi. She is actually one of the authors who like we did in this study. She is the international visiting faculty here also. So we did with her. She is actually a regular practitioner of this practice, this Om chanting and the Vibhaga and other practices that I mentioned earlier. So we did this and we get a very good results in terms of the autonomic responses. So we have 2 kinds of analysis in this. First of all, I will try to show the quantitative analysis, where I will show the 2 results, 2 results are the mean RR interval, mean respiration rate interval, where we have the 5 stages or the 5 levels of the readings that we took. So initially, just to make you a little understand in a better way, the maximum the value of the RR interval, higher is the parasympathetic activity. So here, while before in the beginning, we recorded it was 1066. Then when the Savitri pranayam was done, just to let you know again, 6363, inhalation in 6 counts, holding in 3 counts, and exhalation in 3 counts, and again holding for 3 counts. Half the time we hold, then the inhalation and exhalation. So during that, the parasympathetic activity increased. Then again, when the Vibhaga pranayam, where the holding is more, the sympathetic actually come into its dominance, but less than the initial one. Then again, when the Om chanting was being done, it was the physical activity, so definitely sympathetic dominance was there. But immediately after, like while chanting Om, it again rose to the parasympathetic dominance. And after that, just after that Om chanting, it raised immediately it rose to the parasympathetic dominance. So it was more than how it was initial, but less than the Savitri pranayam that we did. Similarly, the heart rate, the stress index also was measured, and it was found. This is the time over. There is no like pre-bell. Okay. So LF and HF ratio, just 6 minutes, right? Okay. Oh, sorry. So this was the result that we found, and where the LF and HF ratio was found to be very it was showing the parasympathetic dominance was more. So it was a high change from the sympathetic to the parasympathetic. So it was showing a huge parasympathetic activity as soon as we practiced the Om chanting just after when we measured it just after the Om chanting. Yeah. Again, we have the qualitative analysis where we observed the scattering where the thoughts were being actually normalized how it was initially. So we can see, so you can see in the normal in the beginning, the thought processes that the participant was mentioning was scattered. And in the last post-intervention, if you see, it was maintained a state of relaxation. Like when Pranava was there was deep relaxation, awareness attained with a sense of dissolving physical boundaries. So it was showing that you have the thought process again coming up where she was mentioning, but she was in a state of relaxation. Next slide, please. So the conclusion that we come on the chanting of the Om Pranayam, Om chanting with the Savitri and Vibhaga Pranayam, that it gives autonomic balance and it gives, it enhances the parasympathetic nervous system activity. And it is very much important, like in terms of the yoga therapy and music therapy, wherever it can be applied, this sound actually helps the whole body in a very holistic way. So this can be used in many therapeutic settings. Next slide, please. So the limitations that it was signal circuit research design, which actually limits the general ability, and it was for the short duration. So more number of participants can give a more better results. So that can be done in the future research, and we can do in a larger sample size. Next slide, please. So these are the references. Thank you.
Third presenter is Sayan Sikdar. He is in the second semester of his postgraduate diploma in music therapy.
My name is Shan Shikdar, and I am the PGTMT student here. And my music therapy journey started about just 10 months ago. And as you can see at the title, that it's about my understanding how music therapy is integrate in the salutogenesis. So, and Professor Janita Karen is guiding me to make this PPT, and thank you, ma'am. And so I'm not going a very difficult way. I just simplified that thing, that what is salutogenesis and what is the focus of the salutogenesis. It's about the salutogenesis is about understanding the origin of health and explore why people remain healthy despite stressful and challenging life circumstances. So what is the focus of salutogenesis? The salutogenesis is focused on the origin of health, the focus on factors that support human health and well-being. In the medical field, there is two ways of healthcare system, that is pathogenesis and salutogenesis. The pathogenesis is more focused on to the cure the disease. It's about how to cure that person in medical way. But salutogenesis, as you know, that is a holistic approach. It's about to searching about what causes health. It's more health oriented. So if we face any challenges or some stressors is come towards us, so there is two ways. That is, if we take salutogenesis way, that uh, move us towards the positive health, and if we take pathogenesis way, if move towards us to the negative health. Health here is not about only physical health. Health here is about the physical, mental, and social. There is three pillars of health, and the balance of the three pillars is for good health. So what help us to stay healthy? The antonomous skills give us the salutogenic answer, that is sense of coherence. So source of coherence is the orientation towards the life. So how can we understand the stressor or challenges in front of us, and how can we predict, manage that challenge, and how um, we get from the challenge after coping that challenge. So there is three components of sense of coherence, that is comprehensibility, manageability, and meaningfulness. Comprehensibility is more like our understanding. What we understand about the stress or if the challenges come in front of us. And manageability is like how we manage and use the resource to manage those challenges. And the meaningfulness is about our motivation or the find the meaning of the challenges. So it is, these are the thing that builds us the strong sense of coherence. Like stability is about the understanding what going to happen. Load balance is like more the resource has to be not too easy or not too difficult to coping. And participation is about the contributing to the society, is what is our value in the society. And social support, social status, education, money, and righteous faith, religious faith also are in the strong builds the strong SOC. So these are the components of to build a these are the resource that helps to resistance ourselves to the to those challenges. And there are two types of resource, resistant resource, that is generalized resistant resource and specific resistant resource. In simplify, if I say like generalized resource is more like every person has our own resistance towards the stress or towards the diseases. It's about in us, that is generalized. But when the external intervention is happened, that is SRR. So in this diagram, I just explain about that resistance resource is increasing our sense of coherence, and sense of coherence use those resistances to achieve the health. If we go more deeply, that general resource that every person we have, that is increasing the sense of coherence, and sense of coherence when use the GRR, but when the stress is more stronger and not enough, then the SRR come in, intervention come in, and jointly it increasing the health. So how music therapy is useful in GRR SRR? In my clinical practice, I posting, I use people like say like they like music because it's they after listening music they relieve stress, they relieve anxiety or something. So it's they knowingly unknowingly know the that listen the music to relieve their stress. So this is the physical benefit, mental benefit, emotional benefit, and social benefits. But in the SRR, the intervention happened. The personalized intervention and the evidence-based techniques or methods and therapeutic goal. So music, when it's come to SRR, it's became music therapy. So these are the four techniques that the music therapy we used usually. We used is creative music therapy, improvisation music therapy, receptive music therapy, and creative music therapy. And these are the benefits of music therapy: is promotes emotion health, helps patients coping the stress, boosts psychological well-being, reduce anxiety, stabilize blood pressure, improve sleep quality, mood, and memory. And in the Salutogenesis, we face some challenges in hospital settings that the challenges is like we need more evidence-based support to prove the salutogenesis in effective in healthcare system. Looking at disease and health as separate. Health disease are and health and is not the same thing. It's a difference. As I said before, the health has three pillars. And the policies of healthcare bodies will still has to be improved, because salutogenesis get chance to get has to get chance to more involved in the healthcare system. And these are the solution, I think, that is modifying the present practice either directly or indirectly, challenge in the healthcare policies of the institute, guide and educate the healthcare professionals. And these are the reference. And thank you.
Okay, so the next presenter would be Danya. Danya is also a master's student here. She just completed her exam last week. So yeah.
Hi, good evening all. My name is Danya. I completed my master's last week.
Louder.
I am small and my voice is also too feeble, sorry. So, title of my presentation is, Can Music Therapy Benefit a Child with Specific Learning Disability? It's a sample case study. My guide was Janita Karen Rajkumari. She is assistant professor here in SMT. So my topic is specific learning disability. It's a neurodevelopmental disorder. An individual who is suffering from learning disability may have difficulties in reading, writing, speaking, listening, and these are the types of SLD. That is dysgraphia, that is writing disorder. Dyscalculia is mathematical disorder. Dyslexia is reading disorder, and dyspraxia is coordination problems. Next is music therapy. According to WFMT, that is World Federation of Music Therapy, a professional use of music and elements of music is an intervention to optimize quality of life and improve physical, social, intellectual, and spiritual health. And need for this current study was as per in India, the study of music therapy in SLD is very less. So this was a research project, how music therapy will affect in reading and writing in children with SLD. This is my case details. The child was a male. He was 10 years old. He was diagnosed with SLD in the age of 6. And in the beginning, he went to a normal school, and from there, he was having academic backward, and his speech was delayed. They first took him to a speech therapist, and later he was joined for a special school. From there, they reported restlessness and selective engagement. He won't listen to any of the instructors or tutors in the school. This was my first assessment, which I did for him to make an objective. I used GLAD, that is grade level assessment device, in which I used reading and writing eye test. I did the assessment on reading and writing using GLAD assessment, and attention level and strategies was used with the help of the special educator there. This was my aims and objectives. It was to enhance attention level and to improve writing skills. My methodology was, the session was for 10. It was weekly once. Duration was half an hour for half an hour a tape. Therapy techniques planned was rhythmic listening, vocal recreation, and improvisation. And unfortunately, the child won't listen to me. So that's why I was able to do rhythmic listening, and vocal recreation was done by myself when the child was sitting near to me. And even improvisation also I did in front of him. But frequently, he only just observed what I was doing. After that, I did the post-evaluation using the same GLAD tool and as assessment scale. Attention scale. These were the materials I used for the intervention. This was the letters I used for vocal recreation. These tracing letters I used for rhythmical listening. When I sang and I used my instrument tongue drum, this is the tongue drum which I used for rhythmic listening. While he was writing the letters, I played the instrument. I give melodic improvisation for him. And later, after five sessions, I sang the alphabets while he was tracing each letters. During the first sessions, in the first session, he didn't sat with me. He just took the instrument tongue drum and he ran from me and he sat in a corner and he never listened to me. And but I was stuck in the beginning, but later I thought that to proceed with my techniques, which I can bring him to my way. By third and fourth, like third to fifth sessions, slowly he started to observe what I was doing. Sixth and 10th sessions, he started to focus what I was doing. He didn't do the vocal recreation, but when I was doing the vocal recreation, he started to watch what I was doing. But still, when I look at him, he will go on with his own process. This was the improvement. In the first day, he was scribbling like anything in the tracing letters. But after it was 9 days, I did 10 sessions with him. One day he skipped. He didn't allow me to do anything. So that was, it is only 9 days I could do. But there was progress in his writing skills. And here, total score improved from 52 to 61. And reading score also increased, and letter identification was also increased. Here discussion, according to an article which was done in North India, they used the instrument santur for rhythmic listening. But in that study, the therapist mentioned like their writing skills were improved, like their speed of writing and quality of writing was improved. Here I got the result like he was started to trace the letters from scribbling. In conclusion, I can tell that his attention level was increased and writing ability increased. Effective was rhythmic listening and vocal recreation was the techniques I was able to implement more in him. And implications, definitely I can tell that if we are using more musical techniques to a child, definitely we will get good results in LD. And the thing I can tell is, a child who is having the disability, definitely he will move to a medical health problems and physical health problems. While giving musical intervention to him, we can definitely bring him back. So music for healthfulness. Thank you.
Okay. So next presenter is Vinod. He is an observer and he is looking forward to joining us for a postgraduate diploma this year.
Hi, I'm audible. Hi, good afternoon, everyone. I get that this is a scientific forum and it has to be a proper presentation, but please don't mind if it ends up being a TED talk, right? So can we go to the next slide? My journey with music started somewhere, I think, around 1994. That sounds to a few decades ago. I think I was around 6 years old when my mother took me to a music class and introduced me to Hindustani classical vocals. And until then, my understanding of ragas was collection of notes. You put them together, there are a few rules, you follow them, and then you have a musical composition, and that's what you sing. And fast forward so many years later, I see that there are so many more nuances to a raga. And as Sanskrit phrases go, Ranjayate iti raga, which means that ragas evoke colors, they evoke emotions in us, and they do so much more than just basic composition. So you will see that there's a lot of research which says that raga has healing potential. Todi will help with hypertension. There'll be sarang or jaunpuri, which helps with indigestion. And there's rag darbari, which helps with insomnia and anxiety. Can you go to the next slide? So what was the inspiration behind choosing this one particular raga, which is rag darbari? So I think we'll have to go into flashback in the year 2010. It was around my third week of undergoing radiation and chemotherapy when I couldn't speak, I couldn't drink water, I couldn't eat, and I was pretty much like a vegetable and immense pain. I think somewhere in my childhood, what my mom did was got me a good companion, which was the music, because that was the only thing I could speak to and something that I was spoken to. And that is when I was going through a lot of ragas that I'd learned. And this particular raga really hit me home because it provided immense pain management. It was like a very good sedative without taking any medication. And that was my inspiration to start looking deeper into this raga. A few years later, I think my career path changed. I was an engineer in my first career, thanks to South Indian families. Father is an engineer, so you follow engineering. But later, I think cancer completely changed that journey to move towards counseling field, and then I started pursuing counseling as my second career. And music was always an interest, so I wanted to club music and counseling together, and that's how music therapy happened for me. And while doing my research, I came across an interesting study done by, not a study, sorry, historical evidence of Akbar not getting to sleep, but the legendary Tansen singing a similar raga, not similar, same raga, Darbari, and he was immediately stress-free and could sleep like a baby. That was just historical evidence, but nothing can be, taken at face value in the scientific community. So you need to do some clinical literature review. That's when I came across a few more studies, which have also shown that it really does great help for people with insomnia and sleep disorders. So a little more about this rag Darbari. It's also called, the Emperor of Ragas or Raga of Emperors. It's been a very famous and revered raga in Hindustani classical. And what's so special about this raga is that the swaras ga and da are used very oscillatory. I'll try to do an experiential process and see if you all experience that. And the word darbar is more like a court, a Persian word for like courtyards where this raga used to be sung. And Kannada comes because it has a lot of Carnatic influence. So the word Kannada comes from there. Both of them club together. That's how you have Darbari Kannada. Shall we go to the next slide? While you can read about the basics of this raga, how it's sung, and what are the specialities of the raga, let's just do a quick intervention. And I would invite you all to close your eyes for a few seconds. And if you can focus on your breath for a few more seconds. And as you focus on your breath, see if you can listen to my voice and just see what comes up for you. Some colors, some emotions. Sa re sa ni sa re sa ni pa ma pa ni re sa sa re ga ma re ni re da ni re sa ma pa ma pa la ni pa ni pa ma pa sa la ni pa ni pa ma pa la ni pa la ma re re na re sa. A lot of musicians will take it as an offense if the audience is sleeping when they sing, but I think this is what I enjoy, seeing the audience sleep, because then the purpose of the raga is so. Shall we go to the next slide? Shall we go to the next slide, please? Next slide. Okay, so how does this tie up with the study? So as part of Svaram for 1 year course, and you'll see one of the pictures put up where Auroville happens to be my mentor. And this study was done in Auroville, And it was more of an online study. So we had participants in the age group of 18 to 60. Screening was that they need to have some sleep disturbances without any clinical disorders. So that screening was done. And then I'm just presenting a case report of the study that was done. So we did a pre and a post sleep assessment using the Pittsburgh Sleep Quality Index scale. It was a 4-week study. For the first and the last week, we did some sleep hygiene techniques. I'll show it in the next slide. And for the second and the third week, we did the musical intervention. So the 2 minutes that I sang, that was stretched for around 10-15 minutes. It was given to the participants to be heard at bedtime because this is a night raga and it's supposed to be listened close to the time they go to sleep. And they were also asked to maintain a sleep journal and a music journal along with the scores that we were monitoring. And towards the end, we did a qualitative study by taking an interview of the participants. So sleep hygiene, a lot of us still struggle with sleep. So if you want some tips, you can take a screenshot of this and see if you want to practice the do's and don'ts. Be quite valuable. So all this was given to the participants to be followed over the 4 weeks, along with the musical intervention. Next slide, please. So here's a case of a 47-year-old married woman who had sleep disturbances in terms of finding it difficult to go to sleep, waking up frequently in the night, poor sleep quality. And she had some preference of music like alternative rock, but had never listened to Hindustani classical vocals. So it was an interesting participant to have who doesn't have any exposure to Indian classical and to see what kind of findings we got from this study. So the PSQI came down. Not that every test you need to score high. Some tests you need to score low so that there are improvements. So the lower the score, the better the score it is. So the score fell from 9 to 7, which showed mild improvement in her sleep. Sleep latency showed significant improvement. That initially it was 60 minutes to fall asleep, came down to drastically 30 minutes, which was a good sign. Now, this is some qualitative feedback that was given through the interview, that raga helped to relax, the voice was soothing, helped to gain some peaceful sleep, monitoring sleep. The diary was very helpful in tracking our sleep. It was the difficult part of the study was that it happened during Christmas. So best festive season for everyone to travel. So I think one good learning was never do a study in the month of December. What is excellent. Yeah, so these are my learnings. I think pretty much the methodology and the prototype is ready. It can be used on a large scale, both online and offline. And as I said, the interesting learning was that even people who don't know Hindustani classical can benefit from this raga. Future scope, one of the reasons why I'm here is to see it in the clinical setting and to see how we can do some brain mapping or MRIs. Feasibility needs to be observed because along with feasibility is another issue of funding. So we'll have to see how that can happen. And also to observe what is so special about this raga that induces sleep, and also to club subjective and objective experiences. And ultimately, my calling was to do this with the cancer population and see how that helps people with sleep and anxiety. And gratitude to all who were part of this study. I can't keep going over each name, I'm out of time. And also thanks to Dr. Ananda, Shobna ma'am, Bhuvna ma'am, Janita ma'am, and all my wonderful friends over here. Gauri, Abhi, Dhanya, Utpala, Saya, and Gautam, who've been part of this journey so far. So thank you so much.
Hello, everyone. Good afternoon. My name is Anubhuti Goswami. I'm from Mumbai, and I'm currently working as a director of a wellness company called Sanatan Wellness. I am a certified music therapist and a wellness coach. And I have been working with autistic children from the last 10 years. So my subject is the role of music therapy in enhancing communication and mindfulness in individuals with autism. I hope I'm audible to everyone. Yeah, so the objective of this research paper is to explore and demonstrate the efficiency of music therapy in the individuals with autism spectrum disorder to develop communication and mindfulness. It is the need of the time because India is rising in autism. According to a 2021 study published in the Indian Journal of Pediatrics, the estimated prevalence of autism in India is around 1 in 68 children. Boys are more commonly affected by autism than girls, with a male to female ratio of approximately 3:1. What I have observed in autistic kid is they have multiple problems. Every autistic children are different from person to person, as neurotypical children are also different. My child, my 6-year-old girl is neurotypical, but she is also sometimes she's so anxious, she cries a lot, and we cannot define them, we cannot understand them, right? So in autistic children also, I feel that they are very much normal, but yes, they have some behavioral issues which prevents them to learn things. They are very much inward than outward. So if we, through music, we can make them outward or attached to the environment, then it becomes very easier for the parents to make them learn things. So next slide. Yeah. So my literature review objective aims to synthesize this existing research on autism and music therapy and my own case studies highlighting its efficacies to help autism through music therapy. So what is the definition of music therapy? Music therapy is a musical interventions to develop a person socially, emotionally, and in a cognitive way. It is mere just a musical intervention. We can do it in a different way, of course, but yes, person to person varies. As a music therapist, also experience matters. So how we music therapy involves, we understand music therapy, that's how we make people also understand. So now, what are the characteristics of autism? 5 common symptoms of autism are social communication challenges, repetitive behaviors, restricted interest, sensory sensitivities, difficulty with change. All these are very much common symptoms of autism. Next slide, please. So what are the empirical evidence of music therapy? So clinical processes and techniques, receptive techniques, active involvement of music therapy, improvisation, and all these techniques have proven to address autistic syndromes such as controlling anxiety, verbal communication, and improving sleep quality also. So what I have observed in autistic children, if we give them some quiet time music, if we give them some syllable songs, if we give them some very basic percussion instruments, they improve very faster way. Next slide, please. So in autism, what I have observed is the child doesn't want to communicate. They are like, they want to show something, they want to point out something, but they are not able to utter things. So they have non-verbal communication. So non-verbal expressions are there, but through music, we can develop their self-expression. Through music, if I give them a do song, kind of do 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 do. So if it is very common thing for them to utter the do rather than do, it's difficult. So they are very much interested to do the syllable songs rather than doing the full song. So I give them syllable song and quiet time music also to control their anxiety, structured interaction, receptive and expressive languages they are also given. And through these techniques, we can develop their communication, control anxiety, and also their mindfulness. So here methodology is data collection, of course, and these data for this report was gathered from different reputed academic and clinical sources such as books like Music for Special Kids by Pamela OTT, Kids Music and Autism by Dorita S. Berger, etc., and several of my own case studies. Data analysis, information was systematically extracted from selected sources, focusing on key findings related to music therapy's effectiveness, therapeutic techniques, and clinical processes. Analytic methods through quantitative and qualitative analysis. We tried to synthesize the findings through effectiveness analysis and outcome measures. So what are the results? So this research highlights the transformative potential of music therapy for autistic individuals, and also in a relatively short period, often yielding quicker results compared to traditional therapeutic interventions. So what I have observed is, through the case studies and also the studies that I have gone through, that if we intervene a child with music along with the behavioral therapy and also special studies, we can make them very much expressive and also control their anxiety, hyperactiveness also through music. My key findings are like singing syllable songs and rhymes with personalized words selectively enhances communication skills in autistic individuals. And now I'm going to give you an example what kind of music I give them. Next slide, please. Next slide, please. Yeah. Here also I have written that reduction in anxiety and improved sleep quality also is observed through 60 BPM music, which I have designed for them as a quiet time music. So I'm going to make you listen a little. Next slide. Next slide. Yeah, so the first music, please. So here in this music, I have utilized very acoustic instrument like guitar and all, right? So next music, please. So I have designed a good morning song for them. Start the day, start the day. This is the way we start the day, so early in the morning. Say hello, say hello. First we smile and say hello, so early in the morning. Thank you so much. Thank you so much. And I accept that music is only for helpfulness. We can utilize music in a various way, not only to neurodiverse children, but also to neurotypical children. Thank you so much.
It's Samuel.
Good afternoon. First of all, thank you for this opportunity. Good afternoon, CPS. Good afternoon, academics, clinical experts, students, and I am here to present a paper on adoption of music therapy in healthcare managerial perspective. Before we get into the topic, I just want to acknowledge something that my background is in healthcare management, and I am not a music therapist or a professional musician. But I always had an interest in music and research, and that drove me to do this paper. And as we all know that music therapy is a therapeutic intervention practice where we engage patients in trauma, pain, and unstable conditions with rhythmic activities to manage their pain and stress. And it has been since a few weeks I started exploring what is music therapy, and I was really surprised of its clinical and non-clinical benefits. It is known for reducing the cortisol levels and producing more endorphins. The cortisol levels are nothing but the stress hormones which is produced by the adrenal glands of our human body, and the endorphins is derived from endogenous morphine, which is the pain reducing substance that is produced within the body, and it also reduces the blood flow to the amygdala. Amygdala is nothing but the almond-shaped structure which is present in the temporal lobe of the brain, which is known for its fear and threat detection. By reducing the blood flow to that amygdala, we can find a significant stress and trauma detection from patients. And the non-clinical benefits of music therapy is it enhances the patient's experience. Obviously, so many people, so many case studies of patients who were recovered by music therapy, and it increases the reputation by WHO when actually this website. It is nothing but the word of mouth marketing, where when a patient experiences music therapy in a healthcare facility, they need to share their experience to other people when they go outside in their daily diagnosis to build the reputation of the healthcare industry. And it is a very competitive advantage for a hospital because only less than 5% of hospitals have adopted music therapy in India. And the objective of this paper is to understand what is music therapy and to explore its clinical and non-clinical benefits and to construct a comprehensive plan to implement music therapy in a healthcare setting. And to prove it is uncompromisingly one of the best therapeutic intervention methods. And these are some case studies, renowned case studies that I have reviewed for making this paper. And I will discuss this in the upcoming slides. And this is the methodology. It is a descriptive research design. I have not collected any primary data. It is a compilation of secondary data and my whole input. And data collection was done from several financial experts from hospitals and peer group discussion with healthcare experts who are I am in touch with. And it is a thematic analysis to conclude a result. And have broke down several aspects like managerial and human resource aspects, patient aspects, and financial aspects as well. And these are the managerial and human resource aspects. Managers are responsible to do certain work for implementation of music therapy department in healthcare settings. They have to construct a detailed project report and enterprise resource planning. This includes hiring music therapists and allocating resources for buying instruments and making a good setup for music therapy department. And the recruitment of increases the job opportunities of music therapists all over India. And the NABS is the National Accreditations Board for Hospital, which sets quality standards for hospitals. And when we implement a music therapy department in a hospital, the managers would ensure these music therapy department complies with the quality standards of NABS. And it is a competitive because only low rate, less than 5% of hospitals have adopted music therapy in hospitals in India. And this is an implementation flow diagram that I have constructed to implement music therapy department in a hospital. And enterprise resource planning is made. I've done the recruitment of music therapists before because we managers don't have an idea about what is music therapy and what are the instruments we should buy and what is the necessary setup needed. And only after recruitment of therapists, we choose vendors for buying new equipments. And we conduct a pilot study. It is nothing but we will not implement the entire music therapy department to the entire hospital setting. We will implement in a low risk area and we will conduct a pilot study. We will evaluate what are the problems which arise while implementing a music therapy department. And after rectifying every problem, the successful implementation is made. And we don't stop only with the successful implementation. We also try to provide continuous improvement in healthcare facilities. Okay, and everything falls within the ethical compliance. That is the quality standards that are regulated from the National Accreditation Board for Hospitals. And let's go to the financial aspects. This institution, our institution provides music therapy as a complementary medicine and as a service, but other institutions will expect some sort of financial outcomes from a certain outpatient department. And there is a financial statement of a 400-bedded super specialty hospital in Coimbatore. And this is the budget plan which I made for the implementation of music therapy department in Coimbatore. And around 24 lakhs is for initial setup and 22 lakhs is for maintenance. And the break even is nothing but the no profit and no loss point that we achieve. It can be achieved in 3 years or 68 lakhs. So a break even for per year is 20 lakhs 6,666 rupees. By adding a profit of 7 lakh 33,333 rupees, our target is 30 lakhs per year. And this target can be achieved by charging just 20 rupees 50 paise per bed per day. Okay. And this is the estimated cost graphical representation, and it is complicated on this slide. And these are some renowned case studies. These case studies are really important case study where 200 patients were with chronic pain were involved, where they were they are divided into two, one with experience in music therapy, one with not experiencing in music therapy. And there is a significant pain reduction after the chronic pain while we are providing music therapy in the patients. And the last one is post-surgical pain reduction study where 84 kids who underwent cardiac surgery were involved in I will 2 minutes, please.
Yeah.
81 kids who underwent cardiac surgery were involved in this study. As the Danya ma'am said, it is not only for adults, it also helps pediatric patients as well. And this is the graphical representation of the pain reduction. This is the control group is who doesn't experience music therapy, and the state group who experience music therapy. That's a significant pain score reduction of 2 points. And this is the pre-intervention, that is before experiencing music therapy and after experiencing music therapy. And that's a pain reduction of around 4 points, average of 4 points. And these are some references I used to construct this paper. And outcomes are it enhances the patient's experience as we saw from every case studies, and it is absolutely financially beneficial. And it is a competitive edge because only 5% of hospitals have adopted music therapy in India. And it increases the job opportunities of music therapists, and it will subsequently develop the music therapy department and art as well. And why should it be unrecognized? And I believe this paper will reach healthcare administrators and top level managements. It will encourage them to implement music therapy department in hospitals. And music for healthfulness, as we all know, health is not merely an absence of disease. It's the financial, economical, and social well-being as well, and it is absolutely achievable by this music therapy department. Thank you.
Thank you for that wonderful presentation. One of the questions that I have as a researcher, when we are looking at kind of the economic benefit of music therapy and reducing the cost of care, I'm wondering about figuring that into your figures. So if we are showing we're reducing the cost of care, theoretically, in my mind, that should increase the benefit, the economic benefit of having a music therapist.
It is only from the bedside therapy revenue, and there are so many revenue methods to generate money from music therapy, like individual group sessions, group sessions, and so many ways to generate money from.
Yes, after your presentation, I thought I want to take him home with me and have him be my new best friend. This is so important. Thank you.
Thank you. Okay. Next we'll have Utpala. Okay. She is just completed her 3rd semester of the master's program here.
Good afternoon, everyone. I'm Utpala, reading for Masters in Medical Music Therapy. So here today, I'm going to talk about a specific music therapy technique, music life review, how I have incorporated it with a patient who had metastasis breast cancer. So in undergoing palliative chemotherapy. I'm sorry, there are some formatting changes. Please don't mind. So talking about the statistics, breast cancer is the most prevalent among women and takes 11.7% among all cancers, and the most common reason for mortality as well. Chemotherapy, even though it is the most common method of treatment, it also has various physical and psychological side effects, which music therapy can have an impact on in listening. So music life review is a receptive music therapy technique, which is recommended to be used with palliative care patients, like patients who are at their end of life, and especially with cancer patients. But in literature, which has not been used as much as other techniques. So I thought of experimenting this technique with a patient, as I said, with breast cancer and lung metastasis, undergoing palliative chemotherapy. Also, she was a musician, a self-taught musician, and I used her preferred music in the intervention. The aim was to assess the impact that music would do on the physical, psychological, symptoms as well as the overall activities of daily living and overall valuation of life based on the patient's perception and mood enhancement during the intervention. So going towards the methodology, I had 7 days with this patient and along with 5 sessions included in this music life review. Setting was the medical oncology ward where she was going through palliative chemotherapy, and each session was 45 to 60 minutes. I have, as assessment tools, I have used the Rotterdam symptoms checklist, which includes physical symptoms, psychological symptoms, activities of daily living, as well as the overall valuation of life, all in one scale. So I have used this before I started music life review with the patient, as well as after I completed music life review. Apart from that, physiological parameters were assessed before and after the interventions. Talking about the methodology, I did the initial assessment involving physiological parameters, musical assessment, music profile of the patient, and other basic assessment that a music therapist would do. So after the initial conversation with the patient, she volunteered to bring pictures of her past that helped me actually with the technique. So I started the first session. I still needed to know the requirements of the patient really well, because I didn't have a complete idea of how her character is, what does she like exactly, what she had been doing, and so one session I wanted to understand the patient better. In the second day, I started exploring each and every episode of her life with music. So first, she wanted to talk about her career. She was an English medium geography teacher in a convent school. And that was the most preferred time of her life. Why? She loved the independence she gained in this career period and spending time with children. So these are all pictures that she brought to me. And we were able to go through each picture, have explanations to each picture, and bring out music which were associated with that particular period of her life. And she even mentioned a song. She even sang a song that she composed for her students during the Children's Day. And a special moment I would like to highlight here, that after her singing this song, she told me that she heard the applause of the audience that she heard over 30 years back. So I think that was a moment of happiness for me. And then we were looking on the childhood, which was not a very pleasant one because she didn't have very pleasant experiences at home. But apparently she mentioned that all the musicianship she has gained is because of her mother, who taught her songs and hymns daily after school. Her mother was also a teacher. So she was waiting till her mother comes home to learn new songs. So this was, even though her childhood was very negative, as per se, she highlighted this as a positive fact. Then we moved along to her college days. Her college was in Dindikul, so she had to experience the initial Dindikul Talapakati biryani shop. That was an added fact. And she mentioned about how she sang in the college hostel, and all the positive experiences she had during college. So as I said, as per the evaluation done before starting the music life review and after the music life review, physical symptoms and daily activity, her ability to perform daily activities have gone down because we can't do anything for the side effects which are created, physical side effects which are created by chemotherapy. But the psychological symptoms she has been reduced, as well as her overall valuation of life has increased in 50%. which I see as an achievement, not for me, but for this technique. Like we get to explore each and every stage of her life, exploring all the positive things that she did, the encounters, everything in detail, engaging with music. There were no physiological significant changes, so I haven't added. And this is the written feedback she gave me. I would like to mention that she had told initially she saw the hospital. She came to the hospital with a heavy heart, hopeless and frustrated. But later on, she was longing for Mondays, which were the chemotherapy days for her. And apparently, I have made her hospital bed a small heaven, which is really a satisfying fact that in feedback. I think the video will be a good experiential. You can witness the changes of facial expressions as well as body movements with the music. As you can see, she is actively engaged in singing. She had a throat problem as a side effect of chemotherapy, but she didn't stop herself from singing. This was the last review of life. You can see her engaging with body movements as well, apart from the singing. So this was the last session where we looked through all the stages of her life and talked why she likes a particular stage more and all. So yes, it was she was continuously engaged, and even though her health, she herself mentioned that her health is deteriorating day by day, and she was given a date to go up, in her words, but she had passed that date, and it has been 2 months that she had passed the date. So, ma'am, 2 more slides. So, as in terms of music therapy, music life review that the technique I experimented is a receptive music technique. So music therapy is a complementary medicine, which where we address all the biopsychosocial model, biopsychosocial perspectives. So, and it can be seen as a holistic approach. Holistic approach is for healthfulness. So I would like to say music can contribute, especially specific music therapy techniques as such, which are being recommended to be used with certain specific populations, can be used to enhance psychological, physical, and symptoms, as well as the overall quality of life, especially the person's perception on their own life. So here what we have done is not giving her something extra to do, but going through her own life, bringing out positiveness from her own life. So I am grateful that I could use this specific technique with her, but I would say this is only a single person. We can do the same, use the same technique with multiple patients to see whether the outcome will be the same. So yes. Finally, don't forget to look back and see how far you have come. Thank you.
Thank you, Utpala. Next, we'll have Vikram Kannan.
Okay, good evening, everyone. So, my name is Vikram Kannan. Feels good to be back here because I studied here, I did my internship here. Feels good to be meeting my colleagues. And this presentation has a bit to do with my work here and how it changed after I left and went to, from Pondicherry, went to Chennai and started working. So obviously this presentation was done in a hurry, so there's a bit of a mistake there. is developing a music therapy program at de-addiction center in Chennai. Now the thing is, my presentation focuses more on the therapist and the challenges that the therapist faces during while developing a program, because music therapy is still a developing field of work, at least in Chennai, from my experience in Chennai. And the organizations that you do end up working at don't have much of an idea of what music therapy is. So you need to kind of figure out your place in the organization, right? So that is what I'm going to be focusing on. Yeah. So when I first joined the TTK hospital, the de-addiction center, I was given a job there by the management, and honestly, I was a bit confused on where to start. I did go through all of the research on the addiction, but again, I don't know where. I wasn't trained in addiction when I was working here. It was more of I worked in a lot of clinical settings, but with addiction, I was completely new to it. But then again, you need a job after you finish your degree. So my first question obviously is, what do the patients need? I knew they came in with a loss of control, and how society views alcohol and drug addicts is complete. I mean, their view of themselves, very low self-confidence, low self-esteem, a loss of control. But I knew all of these things. I was still a bit confused on how can I go about doing music therapy here, right? So I was just like, okay, let me group improvisation, preferred music sharing. All of this was part of the research, but there was still and there were a lot of cultural differences where I came from and where the patients were coming from. So this was it was challenging, but it was also a reflective process. And I was exploring research and addiction treatment at the same time, but something didn't quite add up. I was doing the sessions, but it also had something to do with the management, I guess, because we were not in close contact. I mean, they just gave me the sessions, and it was almost like, yeah, we trust you, or figure it out, kind of thing. But after about 3 to 4 months, it wasn't really working out in terms of I was constantly questioning myself. Is this therapeutic? What is the point of doing music therapy here? After which, okay, I think a couple of my slides are missing, but never mind. After which I did have a meeting with the counseling and the psychotherapy and the psychiatric team at the organization, and which eventually led me to understand the importance of thematic sessions, which is what they were doing. And if this was done initially in the first month or the second month of me joining, it would have been a lot easier to give the patients what they actually needed. So I settled in on lyric analysis, and I had 4 sessions as part of their rehabilitation program. Each session had a specific theme. I settled in on lyric analysis as a technique which incorporated patient preferred music listening and group singing. And what excited me was at this point, all of the research that I was going through and all of the what I was reading, it started to connect with my practice. And then I knew I was on the right track. And so it was a lapse on my part and the part of the management, obviously, or maybe the team. But then when we started this dialogue, and then I understood the need. I mean, you learn so much about working in an interdisciplinary team, and that thing keeps coming up in music therapy research. But then I really saw what it is to work within an interdisciplinary team. So that made the concept a lot clearer. And group singing, read so much about group singing, and then actually using it within the session made a lot of sense. Because when I'm with my work here, I did a lot of individual sessions. I was working with patients on an individual basis, but there I was thrown into a group session, so I was very confused on what to do. But then things started to shape up, and there are a couple of slides that are missing. I don't know why, but it's okay. But the thing is, though, a lot of what the patients started to say was one of the main things, one of the comments that did qualitative feedback that did excite me was some of the patients said, I do not feel like a patient during these music therapy sessions. And then I knew that they are feeling a sense of control, which is what we need, at least patients who have suffering from addiction is what they need. As much control as possible, because with addiction research and even the neuroscience behind addiction, if you do go into it, you know that there's a damage to the prefrontal cortex and their impulse control, their judgment, their decision making skills, everything is impaired. So I knew, and apart from that, I had the ability to engage reluctant clients in the music therapy session as well. So, and all of these benefits that I was seeing, I was also connecting with in research which was done around the world. And then I was like, okay, this makes sense. I mean, there was a connect. So what I started to realize was it's a very reflective process. The objective of this presentation is also catering towards music therapists who are starting out in the field and being completely confused, which is completely okay, because then you can move. I mean, it pushes you to move into a different direction. Another thing I realized was your relationship to the music you're using, because you're not using the music that you are comfortable with. You're using somebody else's music. I mean, music that somebody else is comfortable with. So how you relate to that music, how the patients relate to your expression of that music, it all plays into the music that we process. So the presentation and my work and my interest started to cater towards that aspect of music therapy. And apart from that, I feel before delving into research in any area, you need to have complete control over the field of work at the end of the day. So, I mean, and there's so much more I still can do, but just doing this. So I've been working here for about 3 years now. And now I'm in a position to maybe go back to using, say, for example, group improvisation and then catering it into my objectives. So yeah, I have a small video of a lyric analysis thing. Okay, what you can do is just go to one of this. I'll just go through the slides on top. Sixth. So yeah, this is all of what was there. And the research that I was going through, I was unable to connect any of it in the beginning. But all of the qualitative feedback was helping me, make connections to all of these therapeutic implications. So the point I'm trying to make is, are you able to connect what you are reading to your practice as a practitioner? If you're a practitioner, yeah. Oops. Yeah. I don't know if I have time for video, but yeah. So this is a video of lyric analysis, just a small part of the lyric analysis technique. So the theme for the session was self-confidence and motivation. The song was obviously a very popular Tamil song. So again, patient preferred music listening, group singing, and lyric analysis. So subtitles, you can't hear it, but it's fine. It's just how they're connecting the words of the song to their situation. And it also provides, so one of the therapeutic implications for addiction research is it provides for music therapy is it provides foundations for cognitive shifts and change in their thought processes, which I could see from the lyric analysis technique. So it was quite interesting to. So this gives me a space into where I can kind of start doing some quantitative or qualitative research to get comfortable with the area first. And then, Is that 8 or 10? 8 or 10 minutes? Oh. Okay, thank you so much. Okay. And thank you, Bhuwana, Janita, all of you for this opportunity. And it's nice seeing everybody again. So,
Thank you, Vikram. We have the last in-person presentation by Priyanka.
Very good afternoon, everyone. Am I audible? Especially at the back. Yeah. We couldn't hear half, so the last afternoon, I'll be the one who'll be saying last. I am Priyanka Dikshit, a research scholar in Department of Performing Arts, Bangalore University. The topic today I'll be presenting is the role of language in music therapy in India. India is a land of culture and language is part of it. We have many states and many states have individually their own language to be precise. But apart from that, there are sub-languages and there are almost 16,000 languages, including the dialects and everything in India. And when we are associating that with music therapy, I think it gets really complicated about how we go about this topic. I'm trying to explain on an outline level, though this is a qualitative research, it might be a little descriptive as well because I need to get a little facts from what is already there. Next. So language plays a critical role in music therapy in India. And when I say language, it is general term saying where language is a way of communication, which has vocabulary and grammar in it. If we take that very outline level of definition, it gets even more complicated. But when we take it in the terms of therapy, we use it in two ways. One, as a verbal communication, which includes counseling and discussion. And second, in the therapeutic methods itself, songwriting, lyrics analysis, improvisation, etc. So these are the two, this is my aim of the paper, how verbal communication or therapeutic methods have an use of use of language in this method. Next. So in the literature review, I have the review on based on language, based on the cultural relevance, which using languages and idioms improves engagement and therapeutic outcome, and the patient empowerment, which means like language choices empowers patient to express themselves authentically. And I have given an example. We have a lack of documentation and lack of research as such when it comes to use of language in Indian music therapy setup. Outside, yes, we've had a couple of papers, but I could come across these two and one more, which are mentioned in the full paper, where this paper, Verma A, doesn't exclusively deals with, the paper doesn't exclusively deal with language, but they're in the process of finding something. They've also mentioned that the language plays an important role. Here is also the same condition. They're trying to find out something else. And by in the chance that Hindi language and regional dialects and vocal music therapy sessions has an impact is what they're trying to say. So these are two literature reviews I could find. Next. So the methodology I've used is, I did prepare a small questionnaire and gave it to 30 participants, irrespective of participants are the patients who came for therapy sessions. And just a researcher-built questionnaire. On an outline, I asked what are the preferences they have of the language. Was mother tongue comfortable? Or what is the language they would prefer to be spoken in? So that was one small research. And otherwise, I had like the descriptive method of what I found in the, which was already there. So with that, I had the results. In the verbal discussion part, the patients felt more comfortable, greater ease in expressing thoughts and feelings when it came to their mother tongues or the language which they preferred to. And there was a good therapist-patient relationship, and the therapeutic alliance was much more stronger when we spoke in their mother tongue or the language which they preferred to be addressed in. There was an effective communication, increased understanding, and they felt a little empathetic. Next. When it came to the therapeutic methods, lyrics analysis, songwriting, and musical improvisation, these three methods and techniques were more fruit bearing than any other techniques when it comes to using language. Patients connected with songs using familiar language and idioms. Patient used their preferred language to express emotions creatively. Patients felt more comfortable improvising with cultural relevant music. So I would strongly say that language plays an important role in music therapy sessions in India. Though we have a very varied and so many number of languages, it has helped, like earlier as we were discussing, it has helped in building rapport. The patients feel more empathetic, they have connected, and it has been more result oriented, both in the verbal discussion part of the therapy and in the music therapy methods itself. So the cultural sensitivity maximizes therapeutic benefits. The linguistic preferences enhances emotional expressions. It has helped in building trust, stronger therapeutic alliances. Next. Last. So the scope for future studies of the limitations I had is further research is needed to be explored to explore the impact of language on music therapy outcomes as such, like different other methods. Then future studies can investigate the influence of different language modalities on music therapy. So multilingual therapy, developing strategies for working with patients who speak multiple languages. So maybe they have two preferred languages. So we can just do much more research on that multilingual therapies. Then cultural competence, training music therapists in cultural sensitive and linguistic awareness. There are certain aspects here in when we think of language. There are formal language, there are informal language, and there are colloquial language. So that was also kept in, that has to be kept in mind. And the volume, tone in which you use the language, including body manners or behaviors, that also plays an important role. It's not only the language. You can say hello, and you can say hello, and you can say hello. So that tone, volume, and the way you present yourself. So language is a little dependent on these elements as well. So including all these, it's a much broader topic which needs to go further, but I've just touched it upon on an outline level with the experience I've had. Any questions? I thank the music therapy department for giving me this opportunity to present my paper here today. Thank you.
Thank you. We have 4 online participants. I'd like to check if they're online. This one, no? Okay. Okay, so we have Vijay Lakshmi ma'am. Who else is there?